Welcome to Duke OBGYN. We are so glad you're interested in training at Duke. Here, you will receive comprehensive training as an obstetrician-gynecologist. Duke's campus is rich in history. I'm here at a historical Baker House on the Duke University Medical Center campus, which has been the home of our department since the 1930s. Our administrative offices are here, and we are adjacent to the renowned Sarah P. Duke Gardens. As a resident, you'll spend most of your learning time at Duke University Hospital and in the Academic Medical Center campus facilities. You will also have the opportunity to train in the county hospital setting at Duke Regional Hospital in Durham County, as well as Duke Raleigh Hospital in Raleigh. This variety of settings provides a rich and comprehensive training environment for our residents.
So here at Duke OBGYN, we are hoping to train the next leaders in our field. Now, to be clear, we recognize that that may look different for all of our trainees. And so here, we are not trying to mold you into a cookie cutter of the type of OB we want to train, but really hoping to help you develop and grow into the OBGYN of your choosing that's going to go on and become a leader, whether it's in research, whether it's on national organization, advocacy, or a leader in your community. We really truly hope for you to become the type of OBGYN that will be successful, be happy, and go on to serve the patients in our community.
You may be perfect for our program if you're someone who is kind, who is gracious, takes care of patients like you would take care of your friends or family. That's what we're looking for. If you are someone who's passionate about community service and community engagement, then this is the place for you. We have our very own community engagement and health equity specialist who allows us to assess what the community needs and allows us to better serve the people in Durham.
One of the things that's probably my favorite part of being here in academics is the opportunity to help learners in their simulation training. We have quite an extensive array of opportunities for simulation here at Duke, both on the GYN and obstetric side. So everything from laparoscopic skills, robotic console trainers, laceration repair, we do it all, and it's probably one of my most favorite parts of being here in education.
Labor and delivery is a place, of course, where women come to have their babies, but it's more than just about having a baby. It's about creating a family and becoming a mother. The moment of delivery is, one of the most powerful moments in a human being's life. When a new life enters this world, and up on labor and delivery, we all are very privileged to be part of that process.
We're there to support each other through the hard days of residency, through the good days of residency, through the hard days of life, and through the really special days of life. And that's something that's really unique about our department, and I think what sets our residency program and our department apart from other residencies across the country. And it's definitely a reason you should think about Duke.
Regardless of where you find yourself in the world of OBGYN at the end of your training, there are a few core foundational principles that we hope to have instilled in our trainees during your 4 years at Duke. And one of those is this idea of being a kind consultant. That even when you get a consult from the emergency department at 2 a.m., regardless of how big or small the question may be, treating that consulting service with kindness and grace, and recognizing that on the other end of that telephone call is a patient who needs your help.
Welcome to Duke. I'm sorry that it has to be a virtual welcome instead of an in-person welcome. I know that the in-person visit is kind of one of the main things that sold me on the program in the first place, and in fact I loved the in-person visit enough that I came back for a second look in January. I know that that path to ending up here is probably not feasible for most people, but hopefully with this video and with email and with other forms of communication, we can approximate the experience of what it would be like.
The Duke OBGYN residency program really trains you to be a well-rounded obstetrician and gynecologist, and regardless of where you decide to practice, whether it's someone's prenatal care, a routine health visit, or someone looking for a complex surgery that needs to get taken care of. The Duke OBGYN residency program really has set me up to be a very confident OBGYN.
Duke OBGYN fosters an environment where all are treated with respect, trust, and inclusion. The department is committed to a culture where faculty, residents, and fellows and all learners experience a place of belonging, engagement, and opportunity. Our training programs ensure that current and future providers are equipped with the knowledge and skills to recognize and address system-level challenges and barriers to care. Our department is committed to research centered on improving health outcomes for all, healthcare access, education, and community outreach to engage our constituencies. Together, through partnership, collaboration, and ongoing efforts, we are embracing this work and are focused on success and progress for all in our Durham community and beyond. The department serves our community through partnership and volunteer programs. Our continued success is dependent on being a place that facilitates the exchange of ideas through intentional discussion and communication. We are committed to Duke OBGYN being a place where people of all backgrounds can thrive. Together, we truly make a difference.
Subspecialties allow a physician in OBGYN to really focus on a specific niche or a specific area, and that really allows our residents to get the full breadth and experience of what each subspecialty is like. Not only do they rotate on all of the subspecialties pretty early on throughout their residency, but they also get to see what fellows do, how fellows interact, both with attendings and with other trainees like residents and medical students. They have the opportunity to participate in research with those different subspecialties, and they have access to national leaders in the respective fields.
The resident experience in maternal fetal medicine at Duke is unique for a couple of reasons. The first reason is that our labor and delivery is incredibly high acuity. We have really, really sick moms, really, really sick babies, and really, really sick pregnancies. And the multidisciplinary team that we've put together between midwives, nurse practitioners, maternal fetal medicine specialists, residents, our nursing staff, all work together to help residents learn how to take excellent care of these incredibly complex patients.
The beauty of training at Duke is that we have a little bit of everything, and there are specialties, faculty members, and mentors that all can fit the needs and your interests. And so I would recommend just staying open-minded and taking advantage of the diversity of opportunities that we have at Duke, especially in our department. And together, we can all guide you to making the best choice for your career and for your lifestyle.
The medical school is known for its research strength, and that certainly carries across the residency program, and we offer a very strong research curriculum that starts from day one. So residents can come in having had research experience and wanted to continue that, or they can come in not knowing anything about research, and we're able to meet them where they are and sort of help them develop their skills. The Duke Global Health Institute has priority partnership locations or organized centers in about 12 countries around the world, and within OBGYN we have a focus on 3 countries in East Africa. I am the director of the Center for Global Reproductive Health, so I have worked with residents on research programs in Uganda and Kenya. There are opportunities to work with additional faculty across East Africa who work in menstrual hygiene, in HIV prevention, in adolescence and family planning, and a variety of other issues.
Residents have experience in the Ryan Clinic during both their second and third years as part of the formal rotation in the family planning clinic. They also get exposure in the first year, in particular with learning about contraception and placing long-acting reversible contraceptive devices. So we have really robust training in contraception and abortion care, and we're really proud of that and think it's really, really important for our residents. The ever-changing landscape of abortion care in the United States, we remain fully committed to making sure that our residents have access to fully comprehensive reproductive health care and full abortion care training.